बराह रास्त आपको ले चलेंगे। इस वक्त आलमी हेल्थ सिक्योरिटी समिट जारी है और तकरीब का एहतमाम किया गया। निगरां वज़ीर आज़म अनवारुल हक काकड़ भी तकरीब में शरीक हैं।
Honorable Prime Minister, do I have your permission to commence the formal proceedings of the first Global Health Security Summit? Thank you, sir. We begin with recitation from the Holy Quran. I invite Hafiz Farhan Aslam to recite a few verses from the divine scripture, which is guidance for all mankind for all times.
Assalamu alaikum. Worldwide. Once again, welcome to the Global Health Security Summit. Together, let us embark on a journey, collaboration, knowledge sharing, and collective action that will leave an indelible mark on the landscape of global health security. Remember, we need to work together for a healthy planet. Thank you so much, Excellencies, for your presence here.
Thank you, sir. Ladies and gentlemen, to set the context for the Global Health Security Summit, we now present for you a short documentary on the theme of this summit and the need for a unified global front against infectious disease and pandemics. I thank you for your attention, ladies and gentlemen. Ladies and gentlemen, the august presence of health leaders from across the world, including ministers as heads of delegations, is reflective of our shared vision for a safer planet. It is now my honor and privilege to invite His Excellency Dr. Hani Jokdar, the head of delegation and minister from the Kingdom of Saudi Arabia, to share his thoughts. Sir.
Good morning, everybody. Dear honorable ministers, colleagues, and respected delegates, I would like to thank the government of Pakistan for their generous hospitality and for organizing this Global Health Security Summit. The Kingdom of Saudi Arabia has always believed in the importance of the global health security preparedness and resilience and acknowledged the tools of the GHSA. Hence, we joined the founding countries back in 2014. In order for all member states and relevant organizations to the implementation of the public health policies, we need to keep GHSA among our top priorities, including IHR amendment and IMB product that we are looking forward to see in the upcoming WHA in May 2024. Excellencies, since we annually meet for the approvals of the tools related to global health protection, we urge you all to put special efforts to fight the silent pandemic of AMR. We cordially invite you all to continue supporting the two upcoming AMR events in the United Nations General Assembly in September 2024 and the AMR Ministerial Conference in Riyadh in November 2024. Finally, we acknowledge the significance of the Pandemic Fund in the promoting and upcoming health product manufacturing and ensuring health security. We believe such an initiative plays critical roles in strengthening the pandemic prevention and preparedness and response capabilities in national and global level. Thank you very much.
Thank you, Honorable Head of Delegation from the Kingdom of Saudi Arabia, Dr. Hani Jokdar. It is now my honor to invite the Honorable Head of Delegation from Islamic Emirate of Afghanistan, Dr. Qalandar Ibad, to share his thoughts. Sir.
Bismillahir Rahmanir Rahim. Nahmaduhu wa nusalli ala rasulihil kareem. Your Excellency Anwar Haq kakar, Acting Minister of Pakistan, Your Excellency Nadeem Jan, Acting Minister of Health Pakistan, Your Excellency Jalil Abbas Jailani, Foreign Minister Pakistan, honorable ministers and deputy ministers from the regional countries, respected colleagues from WHO, UNICEF, the World Bank, USAID, and other academic institutions, Assalamu alaikum wa rahmatullahi wa barakatuh. Indeed, it is a great honor for me to be part of this extremely important summit. I also would like to thank the government of the Pakistan for calling and hosting this summit, where high-level government officials, health experts, and academics come together to discuss the best option to ensure global health security. Honorable colleagues, tackling the infectious diseases globally remain a challenge. We as health experts and decision makers sometimes think that infection diseases are under control, but then we see a sudden outbreak of the diseases that spread to continent rapidly, which means that our diseases surveillance system, detection and prevention method that are in place are not fully capable to timely control such diseases. Moreover, sometimes diseases like HIV, AIDS that took 1 decade to spread globally, and sometimes there are diseases like COVID-19 pandemic that spread across the borders within a month, and even countries with most advanced technologies and developed health system were not able to respond to this pandemic properly. Diseases can take us by surprise anytime because of the gaps we have in our health system and because of the existing disparities and limited resources. Some lessons that pandemic taught us were that no diseases are under control. The world's best health system with advanced technologies could be fragile and will not respond to such diseases and incidences at proper time. And more importantly, the pandemic exposed inadequately is accessing healthcare services in the countries and among the continent. The big 3 infectious diseases, TB, malaria, HIV, AIDS, plus COVID-19, that are usually called disease of poverty, of disease of minorities, are of serious concerns. They together take lives of thousands of people annually, both in developed and developing countries. However, developing countries with limited resources are not able to tackle the major infectious disease alone. Honorable participants, current trend in my country, Afghanistan, shows increase in cases of malaria and dengue ever, perhaps due to the climate change. We also detected some cases in returnees coming from the neighboring countries, which is concerning. In addition, there is also a slight increase in HIV/AIDS cases. However, we also a slight decline in cases of TB. Polio, on the other hand, still is a grave challenge for both Afghanistan and Pakistan. We are trying our best to eradicate the polio virus from country, and fortunately, we have good accomplishment in this area. One of the essential steps to combat the infectious disease is to utilize the available expertise available in the country. As we are witnessing that the funding in Afghanistan is decreasing, but still in our country, instead of national capacity, many international with higher salaries are recruited through the national can perform the same task as international do. I assume other developing countries may also facing this issue. I believe that the above infectious diseases that challenges the global health security and has the potential to spread across the borders could be controlled if proper and reliable mechanisms such as improved global disease surveillance systems, investment in national staff is in place. Moreover, the reducing inequalities in terms of access to healthcare services include vaccination, addressing and promoting awareness on determinant of the health, educate, resources allocation to tackle these adases, suffer of knowledge and exchange of expertise, establishing regional and global public health network to timely detect and prevent the outbreak, and regional coordination platform are some of the ways we could consider to tackle these diseases. To conclude, I once again appreciate the effort of Government of Pakistan for hosting this significant summit. Our region is prone to infectious diseases, natural disasters due to climate changes, low public health awareness, and some social and cultural practice. And when all these factors are coupled and poor health system, this could be a recipe for disaster. Therefore, we need to stay vigilant, and such health summit will assist us to focus on diseases of this region and find out solution to address the challenges and gaps we have in our health system. All the best. Thank you.
Thank you, Honorable Head of Delegation from the Islamic Emirate of Afghanistan. It is now my honor to invite the Honorable Head of Delegation from the Kyrgyz Republic, Honorable Alim Kadir Bahenalev, to address the audience. Honorable Delegate from the Kyrgyz Republic. Sir.
Уважаемый премьер-министр Пакистана, уважаемые участники глобального саммита по безопасности в области здравоохранения, разрешите поблагодарить глобальное мероприятие.
Et les experts safety is not achievable in any human activity, given that the most valuable asset of human civilization is life, and more preciously human health. Ensuring it under the conditions is pressing and important problem. Today I address you with deep respect and a sense of responsibility for our common well-being. With the constant challenges and changes in the world of healthcare, we need to come together and develop strategies to ensure the safety of our citizens. We face threats that know no borders, and it is our task to create a solidarity front to combat them. It is regrettable that the world is not fully prepared to respond to disease outbreaks. The pandemic has highlighted the importance of global cooperation and innovation in the medical field. We must support research, ensure the access of effective medicines and vaccines, and develop action plans to prevent future threats. Health security is not only a matter of controlling infectious diseases, but also of ensuring that quality health services are accessible to all. We must focus on strengthening our national health system, training the health workforce, and providing the necessary infrastructure. Preparedness in the ability to address the root causes of vulnerabilities that can take countries and international community by surprise. Together we can build a resilient health system that can effectively respond to challenges and keep everyone on the planet safe. Thank you for your attention.
Thank you, Honorable Head of Delegation from the Kyrgyz Republic, His Excellency Alim Kadir Bahenalev. It is now my honor to invite the Head of Delegation from the Republic of Tajikistan, His Excellency Mohsen Zoda Ghafoor, to address the audience. Sir.
Dear Honorable Prime Minister of Pakistan, distinguished representative of countries, ladies and gentlemen. From behalf of our country, I would like to congratulate Pakistan with leading and hosting of this very important summit. At the same time, I would like to emphasize that leader of nation of Tajikistan, president of our country, Emomali Rahmon, declared at his speech to the parliament in our republic, 20th of December, these current problems of climate change, about emerging infectious diseases and healthcare preparedness among all other priorities in our country becomes a very big challenges. The President Emomali Rahmon in our country, he developed a strategy as a measure to control these problems, to develop green energy concept, complex and package of measures to prevent and to obtain preparedness of healthcare systems. And previous experience of COVID-19 show us that we only together can control these problems. In our country, our leadership of our country, strong leadership, together with international society, provided 4 cycles of vaccination against COVID-19. And in the region, we received the highest immunity, collective immunity. Even recently, we conducted a study which showed about 80% of collective immunity, which still control our country against new emerging of COVID-19. Lesson learned in the past, especially with COVID-19 preparedness plan, help us to understand better how is important this summit is. And only being together, and we appreciate the efforts done by many international organizations like USAID, like World Bank, GFF, Asian Development Bank, WHO, and other many very important donors helping us creating they render us very important technical assistance and a single approach, standard approach for preparedness for a new challenge for infectious disease. Our country would like to emphasize our strong leadership and support toward this initiative. I wish you all a good summit and good this region, WHO region. We have European part of region, but you are in another. We would like you to join together. We would like to discuss together these problems, not only during the summit and also in other opportunities. Thank you very much.
Thank you, Honorable Head of Delegation from the Republic of Tajikistan, His Excellency Mohsen Zada Ghafoor. Ladies and gentlemen, it's my honor to invite the Head of Delegation from the Republic of Turkey, Mehmet Ardem Al-Gunay, to address the audience. Sir.
His Excellencies, Prime Minister and Federal Minister, honorable ministers from esteemed member countries, and distinguished delegates. Representing Turkish Ministry of Health, I want to thank our brother country Pakistan for great hospitality and convey my appreciation for holding this very important summit. As Turkish Ministry of Health and Public Health General Directorate, we are strongly committed to improve the health security topic. We are making policies and national campaigns to strengthen One Health approach, making interventions to deal with climate change, preparing for future pandemics with the knowledge from the unfortunate COVID-19 pandemic, gathering lessons and experience from the very unfortunate earthquakes in the beginning of this year to deal with public health emergencies. I want to declare that I strongly support the initiative here and to tell that we are open to collaborate on each and all topics. I thank you and wish you all a fruitful meeting. Assalamu alaikum.
Thank you, Excellency. Ladies and gentlemen, we are honored by the presence of the Ambassador of the United States of America, His Excellency Donald Blum. You are requested to address the gathering, sir.
Prime Minister Kakar, Minister of Health John, Foreign Minister Jalili, distinguished guests, thank you for the opportunity to speak today, and thank you to Pakistan for your leadership on the global health security agenda. I applaud the efforts to bring together experts to tackle one of the most significant challenges we face as an international community. Health security is national security, but it cannot be solved by one nation alone. Coordination with partners is the most effective way to address regional and global health threats. Global health security means countries have strong and resilient public health systems that can prevent, detect, and respond to emerging infectious disease threats. The United States has been a leader in health security around the world, such as the remarkable success of the President's Emergency Plan for AIDS Relief, PEPFAR, which has saved 25 million lives, prevented millions of HIV infections, and helped end HIV/AIDS as a public health threat in more than 50 countries. PEPFAR illustrates what countries can accomplish when they have the political will and determination to invest in global health security. Last year, the U.S. government underscored its commitment to advancing human health worldwide when Secretary of State Blinken inaugurated a new Bureau of Global Health Security and Diplomacy to elevate health security as a national security and foreign policy imperative. This new Bureau will work with other governments, the private sector, and civil society to strengthen the global health security architecture. One pillar of the new Bureau is to improve our response to global health threats. Halting infectious disease outbreaks at their point of origin is one of the best and most economical ways to save lives. Effective outbreak response requires preparation and coordination. And the new Bureau can mobilize technical and financial resources to support host government response efforts. The second pillar is strengthening partner capacity. The United States supports foreign governments and multinational organizations to improve those governments' ability to prevent, detect, and respond to infectious disease threats. We'll also use our leadership position to unlock additional financial assistance from allies, donors, and other partners. All of us understand the threat that pandemics and other health crises can have on our societies. They cost millions of lives and billions of dollars worldwide. By investing in our health systems and improving our multilateral coordination, we can more effectively prevent, detect, and respond to outbreaks. Health is the cornerstone to the future of any thriving nation, and the United States will be a strong partner to build this future. Thank you again to Pakistan for hosting this summit, and my team here is looking forward to a robust discussion and identifying strategies and next steps to address our critical priorities. Thank you very much.
Thank you, Your Excellency Donald Blum, the Ambassador of the United States of America. Ladies and gentlemen, the first Global Health Security Summit, a major event, an epoch-making event. Congratulatory messages are pouring in from across the world from global health leaders. We now have for you a special message from the Executive Director of...
और अभी आपके लिए चलते हैं निगरान वज़ीर-ए-आज़म अनवर हक काकड़ तकरीब से खिताब कर रहे हैं.
Assalamu alaikum and good afternoon. I stand before you today with a profound sense of responsibility and a shared commitment as we assemble to address one of the most
अभी सब्सक्राइब करें ताकि कोई खबर रह न जाए.